I hated myself so much, I would displace the hate on others. But
Mm.
now, looking, I think I have about 500 glowing patient experience scores online. I mean, and I went from a place where I have the worst patient scores, like in the University of Washington network, to having like the best at multi-care health system.
Mhm.
The reason why I'm even saying that is because I've listened to my patients over the years. I'm like, so you did that? Oh my God, how'd you do that? What'd you do there? Oh, you did that? Oh, let's do this together now. So, I mean, I've seen over what, 115K around patients in my career and counting. So that's a lot of patients. And that's a
Yeah.
lot of vulnerability and there are a lot of stories.
Mm.
So I took from all of them. So I owe a lot of everything to them because I listened to them over years. When they said, look, you're not listening, when they say, look, you're making it about yourself, when they say, look, you're talking too much about yourself, I listened to them.
A few quick notes before we dive into today's discussion. Though Dhruva is a physician, he preferred that I used and introduced him by his first name. We'll be talking about his lived experience living with bipolarity, and he preferred we did not use the term bipolar disorder. And this discussion, as always, is for informational and educational purposes only. It's not to be taken as medical advice. If you enjoy the content, please make sure to subscribe and share with anyone else who may benefit. Thanks for being here. Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. I have the amazing Dhruva with us today. He is a family medicine physician and a mindfulness based stress reduction expert. And we are going to be debunking some myths and changing the narratives around living with bipolar. What do you want to say about that?
Sure. Yeah. I mean, when we talk about disorder, when it comes to young adults, a lot of the time they'll identify with a disorder. So my thought is to debunk some of that and just unlock the brilliance that's within. Instead of calling it a disorder, we use some mindful techniques, simple empathic techniques that will help you unlock your inner brilliance, whether you have bipolar or anxiety or ADHD. Instead of identifying with the term disorder or disease, let's identify it with anxious and brilliant,
I
or
love,
just brilliant, not anxious.
yes. So we're going to be talking about the brilliance of living with bipolarity. And before we do, can you share a little bit more about yourself?
Yeah, so just really quick, yeah, thanks for asking me. I was born to immigrant parents in Juneau, and my parents lived the American dream for me. But growing up, they still thought it was India. There was a lot of abuse and control, and child protective services, adult protective services. What happened was I moved to Seattle when I was 7. My parents divorced, and my mom would go on to live with schizophrenia for 27 years, institutionalized in and out. My brother, he had a hard time accepting that he was gay. He died about 4 years ago from meth and alcohol. And then I would go on to live in Seattle and get in trouble. And I went to juvenile detention 3 times when I was a teenager. And my family came from India and said, "Look, man, you're done." Okay, like I didn't know any of these people when they came to get me. So it was I don't know if you have a creator or a higher power. It was something beyond me because when I was in the detention center at the time, I'm like, look, God, whoever it is, like whoever you are, if you do something for me right now, I promise that I'll do something for you. Like if you, I didn't even know what it meant to be a doctor when I was 17. I didn't know what that meant. Okay. So if somebody said you wanted to be a doctor, I'm like, okay, well, that's like some other God. That's like that human being level is not me. So, but I think a lot of people should understand that, I didn't grow up in that environment, right? I didn't have Indian friends growing up. I didn't know what it meant to be Indian. Like, I just knew what it meant to be a wannabe gangster. So as you go to India, I mean, and I wanted to be a gangster in India. And there, to be a gangster, you got to study. Oh, then I got scholarships in the medical school there, did undergrad, and then I finished my schooling there. And interestingly, there's a lot of things that happen in between that. And during that time, I didn't have a place to stay after college, after medical school in India. I was in India for 9 years. And then what happens is that I come here, stay with some friends. From the time I had graduated college in India, what was that, 2006? I got into residency in 2009, 4 years. Well, I was out of medical school and residency for 4 years. I was working in a call center. I was working as a pharmacy tech. I was working at Macy's. I remember one time making $17 an hour, and I was like, "This is it, man! I made it in America." Like, because I was gone for so long, and I was working. Are you familiar with Kaplan Medical?
Yes. Uh-huh.
Yeah, so I was working for Kaplan Medical in Newark as the facilitator. It was great. I thought I was on top of the world. I was teaching
Yeah.
step one. I had a low step one score, but I was still teaching it anyway because they were like, well, you can communicate with them well. You get them engaged. Well, what would happen is that I would talk to these guys. We'd hang out, we'd drink, get wasted, go to New York City, from New Jersey. So I was still in that lifestyle. I was in like a clubbing lifestyle at the time. I still didn't really understand what it meant to be a doctor. Because, I'm in India, right? And in India, I'm the American kid in India.
Hmm.
Getting away with stuff,
Yeah.
rapping, I was doing a lot of rapping. So at one point I was confused that I would be a rapper. And so, yeah, so there's those like layers of confusion. And when I got into residency, I was like, okay, so now it's time, something else is happening right now. There's something else that's happening in life. And that's when I really used medical school and residency as a drug to medicate bipolar. Like it was, it was the focus, right? Like I had this intense amount of focus. And it was great because I just remained focused. And a lot of the time when people say they have bipolar, like, I used to say I'm stupid, I'm dumb. Oh, it's because of my bipolar. Oh, they don't like me because of that. But I'm like, wait a second. Gosh, I really study hard and I somehow got into school and I completed my first year of residency when two other people didn't. I think this bipolar might be good. But I never said that to the conversations were very limited, maybe. And it was probably when I was drinking and it was to myself. Okay. So
Hmm.
it's still time I'm thinking that I'm stupid. And then after I finish residency, then everything begins because now there's no drug. There's no medical school. There's no like drug to get into residency. There's no residency. It's like, okay, well, maybe I might do what Jillian is going to do and get into fellowship, is what I was thinking.
Yeah.
Because I lost my mind a half year after I grad, because what do I do now?
Yeah. Yeah,
So
well, working for sure. I know a lot of people are going to relate to that being kind of that numbing agent or the drug. And also to what you said, a lot of people were saying like ADHD, they think it's this burden that they have, and yet that hyper focus is often a characteristic trait of having ADHD, and learning how to change the narrative to leverage the strengths. And along with those strengths, what were you noticing were some of the obstacles that either you experienced or you would anticipate some patients or some people that you know might have experienced that are living with bipolar?
yeah, and that's where this mind hygiene comes up. And it's just, I wasn't nice to myself. That's it. That was the biggest challenge, right? Because when you're not nice to yourself, you're trying to fix your thoughts, you're trying to overcome your emotions, what I call faces. When you're not nice to yourself, you faces your emotions. Fix, anger is overcome. That's the A. C is try to control your mind. Oh my God. Worst thing that I ever could try to ever do
Mm.
is just create the disservice of controlling my thoughts. Okay. And then the other C comes with the cope with. And then the E is erase or block out. And by golly, the worst one is trying to be strong. So when you try to faces your mind and you try to be strong, it's a judgment, right? When
Mhm.
I'm strong, I'm weak. Let me get in that positive environment. Oh, but when it's negative. So then, okay, so the great, what's the answer to that is that you accept things with compassion and empathy, or you
Mhm.
aces it. Yeah, aces it is accept with compassion, empathy, and soften the process, meaning don't make it seem like it's hard. So
Mhm.
that was what it was. So the whole thing was me not being nice to myself, me trying to fix things, drinking, drugging, and then hating myself. So I'm stupid, I'm dumb, I'm no good, nobody likes me. But I'm a doctor, but still I'm stupid.
Yeah, well,
These
can
conversations
I
were happening on a regular hourly basis.
yeah, I want to ask you a question
At
about
times.
that because you were saying you don't want to challenge your thoughts, but in that circumstance, it would seem like you would want to sit and challenge those thoughts that you're having.
Yeah, at that time, the self-hatred was too high, and the overconfidence and the narcissism was too much. Like that was the protective mechanism I had, right?
Mhm.
Like I had to tell myself, look, I'm a doctor, though. So I was trying to confuse myself that because I'm a doctor, I'm fine. But deep down, I think I always like to say that overconfidence is directly proportional to low self-esteem.
Mhm.
The
Mhm.
people who are loud, abrasive, dismissive, interruptive, talkative, don't listen to anybody. That's narcissism. Yeah, and that's what I was. I don't know about anybody else, but those were my narcissistic traits, and it was because of a defense at the time. But whatever I'm telling you, I've only been learning for like the last 4 or 5 years, like
Mhm.
since I've been sober. right? Because during that time after residency, when you're asking me like what I was doing with these things, is I started hating, talking bad about people, complaining, talking bad about patients because other people were, talking bad about friends, family, just complaining, you know, what people call negative, or what I call just like not being the best version of yourself. Because if my mind was clogged up that much with resentment, because I had a resentment implicit bias, right? Everything was a resentment. That person did that. Can you believe this? Can you believe that? Oh, they're like that. Oh, they did that. So that was my day to day.
Mm.
So then what happens is when you're fixing your mind and you're not accepting, I started drinking more. I started smoking more cigarettes. I started drugging, smoking weed, oh my God, gambling, man. Some of the stories, the gambling stories that I have are so ridiculously out of control that I can't believe that I even did. There's time withdrawing $2,000 like hands. There's one time I walked out of a casino with like $14,000. So imagine how much money I lost to make that money.
Mm.
Probably a couple hundred thousand. So those some of the
Interesting.
accounted for debts. So
Yeah.
this is what happens when I was fixing my thoughts, right? And
Mm.
then what happens is I did cocaine for about 4 months, about 5 months, which was like the best thing that ever happened to me personally. The reason why, there are a couple of reasons why, was one, because I wasn't partying doing it. I was writing, and I was talking to a couple other people who were doing it. So there was about two or three of us that were doing it, and I would do it maybe 3 times a week, and we would be up writing and talking about things that happened to us. Like, there's one girl who said she got raped, and I was like, wait, I got abused. I was like, wait, my dad made me hit my mom. Oh, wait, that happened to you. And then we just all start crying. Okay.
Mm.
So we're like having these multiple like crying episodes that I've never cried before in my life. And then one time I remember sitting in a hallway and I started crying. I was like, man, I think I've had a hard life. So that was the first time.
Mhm.
And I don't ever recommend anybody doing it
Yeah.
to for these reasons. But I wasn't like partying, and then I had that mental breakdown, or that substance induced breakdown, the mania, the hypomania, for like the week. And then bless everybody's heart. Okay. Everybody at UW, Valley Medical Center, they're all like, look, buddy, we know that you're going to therapy. We know that you're rapping about therapy, because I was rapping a lot at that time about these things,
Yeah.
like in my own way. So they're like, look,
Nice.
we're going to come help you. So my primary care provider, who's still my provider, who I worked with at the time, and she got me into a program, and I was off of work for 9 months at that time. I didn't know if I was going to be a doctor again. So then
Mm.
I go to rehab for 3 months, it was great. Like, it was the best thing that ever happened to me. And then 3 months I'm off again. So I'm slowly starting to see patients. And then I'm like, okay, everything's here. But see, they all helped me, right? All the doctors, the medical directors, they all believed in me when I didn't believe in myself. So there must have been something. So I'm thinking at these times, there must be something. I think I might be a good person. There has to, because why are all these people helping me?
Mm.
They're the ones who put me into rehab. They're the ones who said, this guy's going to stay here. He's going to make it. And I worked there 2 years after I had this episode in the breakdown. And then after that, I went to another job. And then that was another blessing, where I didn't know anybody and I didn't talk to anybody about anything. So it was perfect. And then I was like, oh, wait, I got mindfulness. Let's see, start talking to I've been to therapy for, as I was telling you, since what, 16? It took me 1 year to say, I think I have a problem. 2 to 3, I was going about 2 times a month. It took me 1 year to say, I think I have a problem. But I still didn't know what that was. I hadn't accepted anything at that time. So yeah, and then what happens is that I start going to more therapy, rapping about therapy, and then I start doing these videos during the pandemic online, and I'm like looking at other people doing the same thing, and I'm like, I'm not the only one. Okay, so I'm not the only one. And I have this YouTube channel that has like, I think 7,000 subscribers, maybe like a couple million views. I was making like $100, $200 a month on this. And I'm like, okay, like, why is this all happening? I have no, because I still think I'm kind of stupid, right? I'm still not nice to myself at this time. But then at one point, what happens is that the changing point was that, I don't know what your belief systems are. You have creator, just a
I
higher
do.
power.
And anticipating the audience has a wide range, but yes, I
Yeah.
have a higher power for sure.
God, I call them God. savior, creator, higher power. So there's this video that I did called Tomorrow Sorrow. And during that time, my brother at that point had died of alcohol and meth.
Mhm.
He had a heart attack. He was dead for 17 days. He was
Wow.
found dead for 17 days with an imprint on the floor. So there was
I'm
an
sorry to
imprint.
hear that.
Yeah.
Oh,
But then as I'm looking at these things, I'm accepting them right away now. There's no fixing the thoughts. I'm like, let me accept it and inspire. Accept, inspire. There's nothing I can do about it right now. So as this is going on, so I had his ashes nearby, and then I was wearing a shirt. One of my friends died of an overdose a few months before that. Friend is a very strong term. I've known this guy since we were teenagers. He beat
wow.
people. Whenever you hear about, remember anybody beat somebody up for you or stood up for you, you never forget them.
Yeah.
And he died. So I was wearing the shirt that I went to the funeral with him. And during that video, there was these mannerisms that I had that I never had before.
Can you give an
Like
example? What do you?
you just gotta watch the video to see it.
Okay.
It's wild. It's not me. Just like
Mm,
certain things with my eyes and the way I'm moving my shoulders. And I was like, man, I never believed in myself. And I started crying. I was like, why did I
mm,
not believe in myself? And that's when it changed. I'm like, you know what? I mean, slowly I started writing all the things down that I've been through. I'm like, I'm really not that stupid. I'm not stupid. I'm not dumb. My dad would say that to me, right? So that happened a lot. My dad would say that to my mom. So we all believed it. My
yeah.
brother too. So we would all talk about how stupid we are. We would just
Mm,
openly say that. So then I started writing these things down over and over. And then after my mom died, I lost it. I'm like, okay. And we knew each other only for 7 years, right? So I took her out of her psychiatric facility that she was in, and the day after I graduated residency. So then I took her out, and then we lived together for the last 7 years of her life. And during that time, I got to learn more. And like, I think there's something more to my life than this. And that's when I resigned and started working as a prison doctor. And then I started speaking, and I'm like, I'm going to become an entrepreneur. I'm going to try to rid myself of the employee mindset and try to donate money and serve a higher purpose. And that's kind of when this journey started. And now I'm starting a channel called Bipolar MD, June 12th. I'll be releasing videos every Wednesday at 4 o'clock for indefinitely. And I'm gonna be all in with this in like the next 3 to 5 years. I'm thinking, so yeah, it's gonna be awesome. I want to share the journey. I don't want to make it about me. I want to figure out how I can show people that if I can go from being 60 pounds overweight. I think you've talked about some, like eating. I don't like to call it disorder.
yeah. I always talk about it's a mental health condition, but for me, it's a behavior, right? I find that for me, anorexia is a behavior, and I equate it a lot to it's a coping strategy, right? So some people feel better when they eat. Some people, like myself, I feel better when I don't eat. And it's an interesting investigation because both of us do a lot of research on our own. I guess it's conditions or way of living and understand what the science says and what where the gaps are. And I find that there's a lot of gaps and a lot of funding that has been deficient for eating disorder care. So I do talk about those issues so that people know that if they have failed care, they know that the care is failing them. And to your point of saying, like, all these things that are happening and all these people that are coming into your lives and supporting you, and finding the mindfulness based stress reduction and finding your own way. And I'm curious to know, like, what aspects do you feel have been most healing, and what things have you felt maybe that are offered traditionally may or may not be supportive of a person's healing journey?
Yeah, no, appreciate that question. Yeah, and I've been trying to learn from this more from the people that are in the space that I don't want to give like doctor advice on this channel and to other people. I mean, I'm coming from lived experiences, and I just so happen to be a doctor. But yeah, and the blessings go to show that, I mean, I can wake up in the morning in freedom. I have home security. I have people who are going to wash my dog when I go to therapy. I have a therapist who I love being around, and I have the ability to write and think about these things. And I've been doing this for years, and I feel like I want to share that blessing because a lot of people don't get to do that. And I was single for 6 years. I'm like, no way, I'm not doing this again.
Yeah.
So some of these things I want to be able to share the tools that I learned during those times. And the tools would be mainly, and when it comes to this concept mind hygiene that I've come up with, it's you can take an example of like, let's say you're at work and you have 17 tabs open, you're like 17 patients behind, you have 17 open charts. I don't know why I do the 17 number, but I've done that even when I've done keynote speaking too.
Yeah.
But yeah, you have the 17, and then you have the 17 resentments, and you have the 17 ways you're going to fix those resentments, and you have the 17 people that you say that you hate, and you have all of these things that are going on. And what happens is that usually people's mind, so that's the awareness, right? So that's the mind hygiene. The mind hygiene is we've just created awareness with compassion and empathy, meaning that we just created the awareness. There's nothing good or bad about it. It's just there. But usually people's minds are conditioned to say, oh, that's hard. They're stupid. You don't need them in your life. Oh, you know what? The reason why they're like that is because, they just hate themselves. And there are all these things that people will, that I used to say, forget it. I'm not going to talk about others. This is what I used to say. And the trained mind would be that, okay, this is it, we're done, we're no good, let's just move on. It's think about mind hygiene like you want to go exercise, and I'm your personal trainer.
Yeah.
I'm going to say, look, create awareness that you want to exercise, condition your mind that you need to eat right. At 9 o'clock you need to walk instead of take the elevator, walk upstairs. You need to go to the gym every day, and the more you do it, the better you get at it. And that's the same thing with this, with the mind hygiene concept, which draws from medical evidence supported therapies like cognitive behavioral therapy, dialectical behavioral therapy, eye movement desensitization, reprocessing therapy, mindfulness based cognitive behavioral therapy, mindfulness based stress reduction, and rational emotive behavioral therapy. And also, I've done metacognitive behavioral therapy, which is so cool. All these are so cool. I get high just thinking about it, doing it again, because I just see the value in it, and it's so valuable. And it's just like, and I consider it like everybody else, all of you guys like coaches. And now I've conditioned my mind to just accept things with compassion, not say
Mm-hmm.
that it's hard, and I'm able to be nice to myself. But how do you do it on a regular basis is what I want to know. And that's where the proprietary process comes in. And I have the registered trademark mind hygiene, but
Yeah.
it's going back and forth with the trade. It's 3 years. It's almost 2.5 years now.
Interesting. Interesting. I love what you're saying about bringing awareness and accepting what is. It reminds me of Byron Katie's work and her book Loving What Is, and the suffering comes in when you're resisting reality.
Mm,
And a lot of times I developed pretty profound trauma symptoms, like a lot of fight or flight. And what I learned is because I wasn't just processing through the emotions and sitting with what is. And so, if we like a lot of times for me and other people I've talked to that have dealt with addictions and the overwhelming emotions, is because we're internalizing or not. If you're working a job where the coping skill is going to be, I'm going to throw myself into more work, and in patient care, you got to go from one room to another without sitting and processing. It's that just being and accepting what is, that is really, as you're suggesting, such a gift to give yourself, even if it stinks at times. Like it's not a very comfortable thing all the time, because as humans, we're feeling this wide spectrum of emotions.
mm. Yeah, no, I appreciate that you saying that. Yeah, and it's a testament to show that, that other people are doing it. And that's the big thing. The next big thing is other people or community. I have what I call the seven loyals. And these guys are guys that I can call anytime. I'm so blessed that I've known them since elementary, middle, and high school. So those are the core group of people that I call loyal, or what other people call as friends, right? So I call them the loyals. That we're there, there's a lot of loyalty. And then you have the other people. I always have people. I was telling somebody, a patient, about this, that I have had about 50 coaches in over the last like 3 years. I've had about 6 therapists, and one of them I'm blessed to be able to have in contact with for like 4 years. So yeah, and I see these guys regularly. So I have regular coaches. Think about, you want to be Michael Jordan of whatever it is, right? Well, Michael Jordan had a coach, an assistant coach, a shooting coach, a defense coach, a dribbling coach, and also whatever else you can think of. A passing coach. They're all there in the NBA. I'm like, why shouldn't I do that? So then I started getting rap coaches, story coach, book coaches. I have multiple speaking coaches. I can't even count. I might have like 30 speaking coaches. So like how Dwayne Wade may be talking to Kobe Bryant to Michael Jordan. I have these connections all the time. I'm constantly in contact with people that are multiple steps ahead of me. all the time, every week. So, now all of a sudden, and none of us complain, right? We're all looking for solutions.
Yeah.
And not only are we looking for solutions, people are asking us to come to do these solutions. And now I'm able to be blessed to get paid to speak on it. And, I donate 20% to certain foundations like in India for bipolar awareness because my mom and my brother, and also the International Bipolar Foundation and the Substance Abuse Mental Health and the National Mental Alliance. So I'll be contributing portions of the money that I make from book sales, from a course that I'm developing on relationships and bipolar and how to have healthy relationships. Because I've been in a relationship for almost a year and a half now, and it's great. And everything that I did for the 6 years I was alone works. It works. So
It's
yeah, I'm
yeah.
ready to share that journey. And yeah, no, we're great. And it just took a long time. What people would say it's a long time, or people call habits discipline. I don't like any of those words. I don't like good habits. I don't like discipline. I would rather just call it an investment. So
And
yeah, and the investment pays off regularly. So now I have passive income of being nice to myself. I'm all the time. I was talking to a doctor who's also sober just maybe a couple months ago. I was talking about empathy in motion is forgiveness in motion is empathy. Yeah, so I don't have any resentment now, right? So now I don't talk bad about anybody. I don't complain about anybody. I don't have to worry about walking out and saying that person did that to me. That's all gone now. My implicit bias is no longer there, and it's all empathy. And that's because I've forgiven myself
mm,
from the first memory that I have. From
mm,
the first memory that I've had that I've done wrong to people, I first forgave myself. And then automatically I was able to forgive others because things that I did that I forgive myself for, I was like, oh, well, oh, that wasn't my fault though. But at the same time, maybe it wasn't their fault. Now I have that, what people call attitude, which I don't like that either. I just like, that's my reality, or what
mm,
people call reframing, right? So just
mm-hmm.
go reframing. But I just like to say, this is my new reality. No complaints. What's the solution? We create awareness. What's the solution? What's the transformation? How do we scale that? How do we repeat it?
And it seems like that walking forgiveness is something happens, you notice, you're aware, curious mind, empathy, and move forward. Is that kind of what you mean by that?
I like this curious mind, Jillian. I just heard
Hmm.
that again, from somebody 2 days ago, like somebody on YouTube or something. I was like, I like the curious instead of accepting and curious. So that's what I am.
Yeah.
I did every time something happens. Why did it happen? Is what I
Hmm.
say.
Yeah.
Every single.
You're giving me the mindfulness vibes. It comes from a place of curiosity without judgment, which is speaking to what you're saying. So you're
Exactly.
embodying it quite well.
It's great life. Yeah. It's yeah.
Yeah, and I find it also it certainly supports relationships, right? Oh, I'm curious why that person did that, or if you're someone that takes things personally, a person didn't text you back, or something didn't go as well. Oh, I'm curious, right? And you were talking earlier about the ego and our narcissistic traits, which many of us have on different scales, different spectrums, and how it shows up and how it affects other people around us. And just having that curiosity of if something happens, it's not all about you. Like, I'm curious, maybe that person was busy. Maybe they have a family member that has a medical condition. Maybe they are running late because they had to support their sick child or something. Maybe it could just be any of those things and not anything about their prioritization of our time together.
Yeah, and I really appreciate you saying all of these things because it's a testament to show that anybody can do it. I mean, if you see some of my before and after pictures, when I'm editing them, I'm like, "Yeah, okay. It's like these are very real. So think about this like this. I was 60 pounds overweight at one time. I don't know if you've seen that picture where I was 220 pounds. When I was
I haven't.
26 to like
Yeah.
29, I was like 60 pounds overweight. And then there was a time where I was 30 pounds underweight because I was on drugs.
Yeah.
So yeah, so that spectrum is there. And the weight that I maintain right now, I would say it's about 85% good, 90%. I'm good 85, 90% of the time. What that means is like this mind hygiene, be nice to yourself. It for the most part, 100% of the time it works. But there are those times I'm like, what did I do to that person? Did I do something? Why didn't that person message me back? I think about these things all the time. But then
Mhm.
the implicit memory is not that, oh, it's their problem. Oh, it's their loss. I don't say any of those things anymore. I don't have those defense mechanisms any longer. I'm like, you know what? I feel bad. And the reason why I feel bad is let me have some empathy for myself. It's because there's been a lot of people who have walked out on me. But you know what? Whatever they're doing is not my business. So now it's over. The whole thing is over now. Now it's the next solution. you know? So
Yeah.
yeah, but that took me years of writing. Here's just some basic stuff, like in the
Mm,
background. So these are just like the basics that I write, that I use the boards to write on here.
nice.
Yeah, so those are just kind of like the day-to-day basics that I'll write these things down that I'm talking to you about. So
Yeah.
that's DBT, or dialectical behavioral
Mm.
therapy, which mindfulness is drawn into, which have a lot of medical evidence to support it. DBT was designed for borderline personality.
Yeah,
Yeah.
I actually like DBT for most people because I find CBT doesn't cater towards understanding our emotions and bringing awareness to our emotions where DBT does. I also appreciated when you validated and recognized, like, yeah, life is actually really hard, right? Like, there's a lot of suffering in life. And I think when we accept that and don't minimize our own suffering, because we can always compare and say, well, his life seems harder than my life. So my life must not have been that hard. We would just validate how our life experiences have shaped us, might have impacted the way we feel. I deal a lot with feeling unworthy all the time, which seems to be like what you were saying. I'm stupid. I'm stupid. I'm stupid. I'm like, well, mine was I'm a worthless piece of poop. I'm a worthless piece of poop. I'm a worthless piece of poop. And until I stopped to bring awareness and challenge that, I would just, it was always playing and shadowing everything that I did. So it felt that I'm not good enough ever. I'm not worthy ever. And then once I realized that you can't gain worthiness in your achievements, I was so empty because I was like, well, that's what I was taught all my life is that if I worked hard and I gained these titles and these statuses and had this career that I would feel worthy. And I was like, I don't actually feel any closer to that.
Yeah, and if you were to, I like the word challenge. So if you were to like challenge and talk to, and I've studied a lot of these guys, like Steve Jobs, Bill Gates, Adolf Hitler. Why are these people in my head? Winston Churchill, all the presidents, all these millionaires and billionaires, and they all feel the same ways. Like when they have home security, when they have a food security, financial security, then the next is emotional security. So then that all of a sudden starts, like, okay, what do I do now that I have everything that I think that I wanted? But
Mm,
in my case, I know there are a lot of Indian doctors, but I never knew what it meant to be a doctor. People just put me into that position.
yeah.
So when I came back from India to look, I was like, dang, there are a lot of Indian doctors. And when they would look at me, they're like, oh yeah, you're Indian, you're a doctor. I'm like, no, I did not know what that meant. Sorry to bust your bubble. I never like
Mhm.
wanted to be a doctor. I love being a doctor now. I'm very grateful for it. And no matter what happens, I'll never stop practicing. There's a point where people start having I always say people deserve rock bottom. People need it.
I find it interesting because my rock bottom and some people's rock bottom. So I left surgery when I was suicidal, and anorexia has a really high death rate. It's currently second behind opioid overdoses for any psychiatric condition. And I find that the risk of waiting to the rock bottom to learn the lesson, which is why I think it's important to hear people who have hit that rock bottom and try to learn from their experience, is it could lead to loss of life without opportunity to change. So sometimes that catalytic event is so risky, but you're right, that deep pain of personal experience and hitting that rock bottom. And I was very risk averse until I hit the rock bottom. And when I hit the rock bottom and realized that all of my achievements weren't going to bring me closer to worthiness, and I sat there and realized like it was the healing journey, just like yours, that brought me into this awareness. It was like I never needed to do any of that to have worthiness as a human. And actually, when we are in this deep training and we're sacrificing our connections and time with loved ones. My ex-boyfriend passed away when I was in residency. It was this clarity of, wow, we are literally sacrificing what really matters for this pursuit of the things that we are told are going to bring us closer to peace and happiness, but they are actually driving us away from it.
Yeah, no, and there's a lot to be said about that. And there was a point in time also, when you're talking about patience, and I'm so sorry to hear about your boyfriend. Yeah, we don't want things to go until it's too late. But when I knew that it was going down that path where I was about to lose everything, is when I'm just like, okay, so I need to do something about this right
Yeah.
now.
Mm-hmm.
Yeah, it's when, yeah, and I was at that rock bottom for what, almost like 9 months, and then 2 years.
Yeah.
Where I had my head down. There's a lot of people who are experiencing what we are. And, there was a point in time where my patient experiences were so bad. The place where I was working at one point was like, look, if your patient experience ratings don't go up, we're going to have to do something. I started doing that more and more. I hated myself so much, I would displace the hate on others. But
Mm.
now, looking, I think I have about 500 like great, like glowing patient experience like scores online. I mean, and I went from a place where I had the worst patient scores, like in the University of Washington network, to having like the best at multi-care health system.
Mhm.
The reason why I'm even saying that is because I've listened to my patients over the years. I'm like, so you did that? Oh my God, how'd you do that? What'd you do there? Oh, you did that? Oh, let's do this together now. So, I mean, I've seen over what, 115K around patients in my career and counting. So that's a lot of patients. And that's a
Yeah.
lot of vulnerability and there are a lot of stories.
Mm.
So I took from all of them. So I owe a lot of everything to them because I listened to them over years. When they said, look, you're not listening, when they say, look, you're making it about yourself, when they say, look, you're talking too much about yourself, I listened to them. I'm like, so why do you, I would ask them, why do you think I'm doing this? And still now, if there's a patient experience that doesn't go bad, God bless, I haven't had any in a long time. I'm just like, what did I do now?
Mm. Yeah,
Mm,
you were showcasing. I was just reading in a mindfulness
mm,
handout. It was talking about the fixer versus the servant mind. And the
mm,
fixer, right? Like I have the answers, I'm going to tell you what to do, comes from the ego. Doesn't,
mm,
and you mentioned the word partner. I love that word in terms
mm,
of changing our mind to a servant type of approach when it comes to partnering with a patient,
mm,
understanding where's the patient at, what are their priorities, what's working, what's not working, and how can we partner with them knowing that they have the answers, they have more the agency in their life. And if we tell them what to do, it's going to be less likely that they're going to want to do that, because as a humans we don't like to be told what to do typically.
mm, mm,
uh, but allowing them to have buy-in to their health, to take ownership of that and say, and I'm here for you, just like that community was there for you.
mm. Exactly. Yeah. When it comes to patients, like, I mean, they're great. I have my patient experiences. I love going to work. I love being a doctor. I like doing everything from documenting this to that to everything. I like doing the PAs. I like doing all of it because I'm serving a higher purpose. It has nothing to do with me. So I have no complaints at work at all about anything because it's just I'm of service. I'm serving a higher purpose. It has nothing to do with me. So that saved my life. One coach, and my therapists have helped me. My coaches have helped me so much. One coach was like, "Look, man, nobody cares about you," and I'm like, "Okay, that's great." So when I leaned into that, I'm like, "Awesome." So now when I talk to patients, I don't think about any of this stuff. I'm like, "So what is the problem that I can solve for you today?" And that's what I say. And like, okay, how do you feel about this? What are your thoughts on this? What are your thoughts on medications? What are your thoughts on not taking meds? How about what are your thoughts on this? And I just say, okay, I'm like, whatever you do. I mean, I'm sober, right? For what, 6 years? But if people are drinking, I'm like, you should enjoy it. Like, if you're gonna have like a drink or two, enjoy it. Like, I'm not gonna sit there and tell people to not, I don't displace what I'm doing. If mindfulness doesn't work for them, sometimes I've even gotten hurt a couple of times where people are like, well, this process is not going to work. But I'm like, they're just not there in that point of life. So now I embrace it. So yeah, it's accepting and embracing emotions versus fixing and resenting them because
Mm.
I'm in my own mind, right?
And
So
yeah, I
yeah.
find that there's such value in developing self-compassion before people lean into mindfulness and spending time with themselves. Because what I had experienced in my own life is like, I'm going to sit in stillness and I'm going to sit with all those self critical beliefs. But then I developed self compassion. And so now my mindfulness practice is from a self compassionate lens. I'm like, wow, okay, now I can see the benefit. Whereas before it was destructive. And if somebody has such stored trauma in their body, stepping into 30 minutes of mindfulness, or we were talking earlier about sessions that were hours long, well, that could flood them, and they have higher risk for that to be
Mhm.
so uncomfortable that it actually leads them to not continue to practice.
Yeah, and that's why I say just sit down for 1 second every day for the rest of your life. But you got to make it an event though, and write down what you're thinking. All the things will automatically come into fruition. Relying on yourself, accepting who you are. I believe that a lot of people will say that I'm confident, but what I like to say is that I believe in myself and then I believe in my limitations. and I approach life from a beginner's mindset. When I did the MBSR certification, I pretended like I didn't know what mindfulness was. And
Mm.
that's what made me very successful. So now whenever I approach anything, I always like, I have a virtual collaborator. I don't like the word assistant. We always have to be able to learn from a beginner's mind. So when she's saying something to me, I pretend like I don't know it, like in my mind. And that's what's led me to have like immense amounts of success. I mean, the bonuses, the jobs, the money, that all follows this. Like you don't even have, you'll have to chase it away. Like at this point, at a stage where you have so much self-love for yourself and you're able to show people how you did it, like all of the things just start coming to you. I never asked to speak. I pooped my pants in 11th grade when I came to speak. Now I'm speaking. I was the keynote at the biggest patient experience conference in the nation last year. I had pooped my pants in 11th grade, like stand in front of people
Yeah,
because I was so scared to speak.
incredible. And it
Yeah.
highlights to the point of you saying you took a learning experience where you had the worst patient scores, now you have one of the best, and now you're teaching others. And I really appreciate you sharing your journey and your experience. And I know I'm really looking forward to your YouTube channel and how that trajectory will go. But just thinking about our conversation today, what are the main takeaways you would like to have the audience have from this discussion?
Yeah, I think the most important thing is what I would say is to learn to be nice to yourself. If I can do it, you can too. If other people are doing it, you can too. Just because whatever I'm saying, it may not work for everybody, but maybe it could be a season, it could be a period of your life that you just say, what did this guy do? How did he go from self-hate to self-love? What he was on drugs, he almost died. What did he do? Maybe I'll just like follow it for a little while and then go to the next person and then the next person. And that's what I would recommend is that there's possibilities, right? The possibilities is that you can have an emotional heart attack, or you can have an emotional attack. Let's call it, an emotional whatever you want to collapse, or the possibilities that you can be in emotional freedom. Which possibility do you want to choose? Just don't talk to people that complain at all. There's no point in complaining because it's not going to do anything. Imagine how much more opportunities that you can give yourself if you're not talking to people who are complaining. And that's what I always like to say is have at least maybe 3, 4 people that are way ahead of you, a little bit ahead, a little bit more ahead, way ahead, way, way ahead. So I have all of those, right? All of the like the coaches that are way, way ahead. Like I have a couple of billionaires that I talk to, not because they're billionaires. I just want to know what they're doing. Like, what are you guys doing, man? How did you get there? And it's not like it's not about money. It's more about just the mindset. And they're so far ahead. Their mindsets are so far ahead, dropped out of college mindsets.
Yeah.
Yeah. Yeah. The entrepreneurial mindset is just so gangster. It draws me in so much because everybody's like just from the bootstraps, right? Just like I started off with $20, you know?
Yeah.
So
Yeah,
yeah.
it is fascinating to hear the stories from the beginning, their origin stories, because we see people when they're successful, but as you've been showcasing, a lot of the success comes from all the experience that came from the growth opportunities, the learning opportunities. I don't use the word failure in terms of thinking that it was catastrophic, negative thing, as much as a growth opportunity, a learning experience. And I also reframed the way I view that because as a recovering perfectionist, I used to think doing
Mhm,
anything that wasn't 100% meant that I was a failure and less than. And it's repulsive to me to even get my
mhm,
brain to offer myself that again because it's so far removed from what I think now. And you've been
mhm.
capturing that throughout our discussion. So I really appreciate it.
Yeah, no, this is great. No, it's good to have these stimulus, the stimuli, where like, well, somebody else is doing this too. Oh, okay, so I can do it as well. And that's where I think is the most important thing. And whatever you do, just do it every day. So yeah, the investments are important and they pay off. It's compounded interest, right? I can sit back and if something really bad is happening, I don't know that it's that bad. I don't know what it is anymore. If something really bad happens, what people consider bad, I just don't know because I've compounded so much interest in healing that you just look for the solution and you implement it as quick as possible.
Mm,
Mm. So it's a
yeah.
great life. I'm
Well,
very grateful. Mhm.
yeah. Well, thank you. And where can people find you?
Yeah, so there is a link that I'll give you for a free book. It's called The Dumb Doctor. Interestingly, very very fitting.
Mm-hmm.
It's because it's how I went from being a stupid doctor to almost losing my job, having bad patient experience ratings, to having like some of the best in like the nation at one point. In terms of the percentile scores, the Press Ganey scores. So yeah, so I've kind of elucidated, like I've kind of explained on what I did and the processes that I did, and it all ties into like customer experience, relationships of any kind. So yeah, it's just a quick read. It's maybe a 2-3 hour read, ebook.
Awesome.
So that
Cool.
people can download that and they'll join an email list where I'll be sending them value-based emails every week on patient experience and just little tips on bipolar. So yeah.
Well, cool. And for
Mm.
the audience, if you have any questions, thoughts, reflections, make sure to share them down below. If you have questions that you want Dhruva to answer on his new channel, of course, we welcome those. And until next time, thanks for being here.